Oday Lavergne for Agilus Health. We'd like to continue with our series of Let's Clear the Air. Today we want to clear the air about back pain. Low back pain is the number one reason to see a medical doctor for an office visit. Low back pain is the number one reason for missing work. Low back pain is the number one job-related disability in America. The cost associated with low back pain has been proven to be 50% less costly if you begin physical therapy in a self-referral mechanism. What does that mean? It means if you see the physical therapist first without seeing the emergency room, without going to the urgent care, or without going to your medical practitioner's office. In America, we're trained to practice wait-and-see medicine. You see your medical provider, you go to urgent care, they give you medicine, they give you anti-inflammatories, you're given a muscle relaxer and told to go home and take them for a week to 10 days. Let's see if it works, and then come back. And if it doesn't, you get more prescriptions, different medicines, and then possibly advanced imaging. We also know now that our cost of an episode of low back pain is 50% reduced if there's no advanced imaging, meaning no CT scans and no MRIs. MRIs and CT scans have proven to be relatively non-useful in the treatment of acute low back pain. We also know that the overall cost of your back care is 50% less if your care is initiated within the first 3 days after the onset of the pain. If you hurt yourself at work, if you hurt yourself in the yard, if you hurt yourself in an accident, if the pain's not gone in 3 days, get to your physical therapist as soon as you can. Recent studies show that physical therapy compared to surgery are equal in outcomes. And surgery has risks. Surgery has risks of anesthesia, surgery has risks of post-operative infections, and some of the complications of surgery are life-threatening. New aggressive spine surgeons always prescribe physical therapy before considering surgical interventions. If surgery does become necessary, then they always prescribe physical therapy post-operative. Patients that were able to begin physical therapy within the first 3 days of the onset are more likely to never ever need to have opioids. Again, opioids are not good drugs. They're not helpful at all in the recovery or the healing process. They only mask and cover the symptoms. So let's clear the air for a moment on opioids. In America, opioids kill 130 people a day related to opioid overdoses. That's 30% more than people are killed in automobile accidents. Approximately 108 people a day are killed in automobile accidents in America. We are killing more people in America with opioid overuse and overdoses than we are in automobile accidents. 80% of heroin users report misusing their prescription opioids prior to their heroin use. Physical therapists treat patients with the use of prescribed movement and exercises, hands-on care, education, and nutritional advice. So my advice to you is start physical therapy within the first 3 days of your pain. Avoid the use of imaging and MRIs. Avoid the use of pain medications and opioids. And to reduce the cost of your care for low back pain by 50%. You have nothing to lose but your pain. Just give us a call.